6 months ago, we made the very difficult decision to hand our contract back to the health board. I felt guilty, and I felt an immense sadness. The general feeling of patients was that they didn't want to lose their practice, and that makes me feel extremely sad.
Earlier this year, Dr. Llynnos Roberts joined hundreds of GPs that have made the difficult decision to give up their partnerships.
When I first started as a partner 12 years ago, there were 6 of us. And over the years, we lost partners for various reasons. So we were left with 2 partners within our practice, and I felt that we weren't able to deliver safe and effective healthcare for our patients.
In the last decade, 100 GP surgeries in Wales have closed. GPs in Wales continue to have unsustainably high workloads, and it is getting worse. A recent survey by BMA Cymru Wales revealed that 92% of GP respondents had concerns about their own well-being as a result of routinely high workloads. And an alarming 87% said they believed this was impacting on patient safety.
I probably have 30 to 40 patient contacts a day, which is way above the sort of recommended amount, but we're just trying to, again, firefight the volume on the day as much as possible. I'm routinely working a 12-hour day. I don't have a break. I eat a sandwich by my desk.
With rising surgery closures and fewer GPs, each doctor is now seeing up to 35% more patients, and patients are feeling the impact.
You do get this impression that they're just firefighting all the time.
More recently, it has got more difficult to get an appointment in a timely fashion, and quite often appointments aren't available for at least a week or 2, which is just too long.
I'm sure they've gone into the profession to help people, but that must be really difficult when you're under that pressure of you're not getting any more money, but you're having so many more patients to have to deal with. There's only so much, everyone's got their limits, haven't they?
91% of GP practices reported routinely being unable to meet patient demand, impacting the availability of appointments. High workloads and burnout mean GPs are considering their exit. Only half of GP partners intend on being in a GP partnership in 3 years' time, and only a third of practice salaried GPs intend to work in that capacity.
From the cohort that I was in medical school with, so many are not working or working very reduced hours, just the intensity of the job. I think at the moment the job has a shelf life because it cannot be sustained over a career of 40 years. There's absolutely no way. It's devastating, I think, because we need that experience to train up and coming doctors. We want that experience to help people clinically as well. It matters.
Patients and GPs are united on the importance of family doctors.
I love the relationship we have with patients. It feels a real privilege to have such a close contact with them. I saw a gentleman a few weeks ago just in the waiting room, and I called him in because he looked like he'd lost a lot of weight, and I wouldn't have known that not knowing him, and that triggered some immediate investigations and a quick diagnosis. It's so hard to measure those things, and I think that's where it's hard to see the value on a whole population level. You look at it on an individual level, and that's where you see the real benefits of it.
General practice needs an urgent lifeline, and patients agree.
If we don't look after the workforce, if you don't look after the workforce, you're not going to have a workforce in this situation. It's just going to get worse and worse.
Just improve funding for our surgeries, do everything they can to support them, to stay open, to serve their communities.
Save our surgeries before it's too late.